Hello everyone. One of my friends, who is now a neurophysician, she herself has a disease which is debilitating, taxing on her health, but still she didn't give up. That is nothing but multiple sclerosis. It is actually a foreign disease to Indians because it is an autoimmune disease which is very commonly seen in European and foreign countries and rarely seen in India. But nowadays, due to a lot of factors like lifestyle modifications, genetic variations, and the environmental conditions, this disease has slowly propped up into our country. And we are seeing now a lot of young individuals suffering with multiple sclerosis. What is multiple sclerosis? It is an autoimmune disease marked by the inflammation, demyelination and gliosis and damage leading to few acute symptoms, and sometimes it can become progressive and chronic disease, which is neurological dysfunction leading to a substantial disability and a reduced quality of life. It impacts nearly 2 million people worldwide, and this was initially described by Jean Martin Charcot in 1868. He observed certain individuals with tremors and a weakness in their limbs, very typical and different people who are very young. They are not supposed to have the tremors and the stooping posture, difficulty in walking, like usually how the old people get. So, he thought of researching on them, and he tried to describe classic features of this particular disease as Charcot's triad. He identified people with symptoms like tremors, scanning speech, nystagmus, paralysis, and sensory bladder symptoms and called them into this Charcot's triad group. Over a period of time, research and lot of studies on this disease has concluded it as multiple sclerosis, and the evolution of treatment in this particular disease is dramatic. There are a lot of geographical variations in the way this disease behaves. So, like we know, the equatorian countries which are close to the equator are little bit hot. So, the countries which are away from the equator or near to the northern or southern pole, which are colder, have a higher incidence of this disease. Due to the migration, when people migrate at a very young age, less than 15 years, to these particular areas which are prone to have autoimmune diseases, people can develop and their incidence becomes equal to the local population. It's a disease of typically young individuals ranging from about 15 to 45 or 50 years of age. Nevertheless, it is also seen in some kids, that we call it as childhood multiple sclerosis, and even few elderly people who can present for the first time with their multiple sclerosis episode. Certain environmental factors like cigarette smoking have been attributed to the risk of multiple sclerosis, and dietary habits like consumption of more fatty and animal meat has also led to this disease. Vitamin D deficiency, like it is attributed to many other conditions, it is also seen commonly in patients suffering with MS. And there is a lot of patients coming up with a history of viral infections, respiratory infections, or vaccinations preceding to the episodes. Few fever episodes can aggravate the symptoms of multiple sclerosis. If we see the pathophysiology of the disease, there are multiple genetic factors, environmental factors, and infectious triggers which activate the T helper cells in our body. The T helper cells are a type of white blood cells which produce certain reactive substances like cytokines, chemokines to fight against the diseases or infective agents, foreign substances entering our body. But due to an autoimmune or hyperimmune reaction of our system, sometimes when these cells are activated against our own body cells, they start attacking the nervous tissues and they get infiltrated into the central nervous system. So, when we talk about the autoimmune neurological conditions, especially they are divided into central and peripheral nervous issues. The peripheral inflammation caused due to any autoimmune reaction can be termed as acute intermittent demyelinating polyradiculopathy, that is AIDP or GB syndrome, and if it is progressing chronically, it is termed as CIDP, that is chronic inflammatory demyelinating polyradiculoneuropathy. If the same inflammatory and autoimmune condition affects the brain and the spinal cord, that is the central nervous system, then it can be multiple sclerosis or the transverse myelitis occurring in the spinal cord. It can be MOG antibody disease or neuromyelitis optica spectrum disorder. What exactly is happening in all these diseases involving the autoimmune central nervous system disease? There is a breach of blood-brain barrier and the immune cells which have to recruit a lot of chemical substances fighting against the foreign objects, they enter the nervous tissues. So, the tumor necrosis factor and the cytokines cause a lot of damage to the CNS tissues, produce local inflammation, edema, gliosis and a scar tissue leading to the death and damage of the nerve cells in that particular region. What happens if a nerve gets damaged? The function of that particular nerve is lost. For example, in multiple sclerosis, if we see the localization of the lesion, it can be there in the brain, cortex, juxtacortical regions, periventricular areas or in the cerebellum or brainstem. Once it crosses the brain, there can be lesions in the spinal cord which are usually short segment involvement in multiple sclerosis, unlike to the long extending transverse myelitis seen typically in NMOSD and MOG antibody disease. Apart from this, there can be optic neuritis, inflammation of the optic nerve, which is commonly associated in 30 to 35% of the patients with multiple sclerosis. What are the types of multiple sclerosis? When the disease is very benign in nature, mild, rarely relapsing, and patients are not functionally disabled, then we call it benign multiple sclerosis. When it is very severe, sometimes it is labeled as malignant multiple sclerosis. Classically, the terms which describe the progression or the course of the disease are relapsing remitting multiple sclerosis, or we commonly call it as RRMS. It is the most common type and very frequently relapses are noted in this particular condition. I had a patient recently admitted under me who is a Russian person, traveled to India and she was diagnosed with multiple sclerosis. So, what she described was, for the past 15 years, she used to have once in a while pain in her eye, vision will be reduced for a particular period of time and few days later it recovers by itself. Sometimes what happens is there is a numbness in her leg or weakness in her hand for a couple of days and slowly she regains her normalcy. But she ignored all these symptoms until she felt really weak, fatigued, and to carry out daily activities. That's when they presented to us. When we evaluated and took the entire history of 15 years, I came to a conclusion that she was suffering from relapsing remitting multiple sclerosis. 70% of the patients who have multiple sclerosis present to us with this pattern of relapses and remissions. Also, we describe primary progressive multiple sclerosis, which is like the patient develops a weakness which progresses, and it never stops. So, from the beginning, it has been only a progressive course, gradual onset and slowly progressing. Finally, they will have very debilitating condition. 10% of the multiple sclerosis patients can have primary progressive multiple sclerosis. There is another variant called secondary progressive multiple sclerosis. To begin with, it behaves like RRMS. There will be certain relapses, remissions, so we consider them to be RRMS. But over a period of time, when we see there is no remission, there is only relapse, and then the neurological deficit stays there. Adding on to the another relapse, they will have further progression of the disease. So, the symptoms steadily progress and they deteriorate over a period of time. Also, there is a term called progressive relapsing multiple sclerosis, where there is a continuous progression from the onset, but they are interrupted clearly by few episodes of relapses. So, they can have definitely few relapses, at the same time the progression contributing to the piling up of disease.